power of virtual consults. Now, what we want to keep in mind is that virtual consults and telehealth, telemedicine certainly existed prior to COVID-19, prior to practices shutting down. But what we didn't expect and what we did see is that during the shutdown, during shelter-in-place orders, it just became such a smashing success, and really the success of telemedicine skyrocketed. So with that, we're going to talk about some of the things you want to keep in mind when you are performing virtual consults in your practice. Now, you may have been performing these while your practice was closed, but really, if you haven't already, we strongly encourage you to pick back up, continue doing these, and make them a part of your practice even once your office and your practice reopens. There's a number of reasons. We know that for safety reasons, health security reasons, patients may not quite feel comfortable coming back into your practice yet, and that's okay. We understand that. We want to make sure they're as comfortable as possible. We know that this is an excellent way for patients to get to know you, get to know your team during a remote consult, during a virtual consult. That being said, for some practices that still practice insurance, check on the correct ICD-10 code for the particular procedure that you're looking to treat with. For non-insurance, right, so for the fee-for-service, for whether we're talking about a consult for injectables, for laser RF devices, whether we're talking about surgery, because we know that some of you could be surgical practices. What we want to look at is how can we utilize this to our advantage? We find that virtual consults help in the pre-screening process. So in other words, you're not able to obviously inject a patient remotely, but you are able to tell if they are not a good candidate or if they're going to be a candidate for multiple procedures. A patient may call, they may have questions about a particular neurotoxin, and you come to find out once you see them that there's so much more you're able to do for them. You can also consult on skincare. What are some things that you're able to sell them in the portion and process of retail that you might not have been able to do that if you were simply speaking with them over the phone? Again, my name is Shorr. I'm a partner in Shorr Solutions. Thanks so much. Stay safe.